Hi there, my name is Dr. Lanzasera. I'm a psychologist here at Henry Ford, and today we're here to talk about anxiety. We've prepared this presentation so that you can understand what anxiety is and how we go about helping you to overcome that anxiety. We know that anxiety is a very stressful and difficult thing, and it can be very impairing to many individuals. The treatment for anxiety involves a number of things, medications and psychotherapy. Today we're going to talk about the psychotherapeutic approach to managing anxiety, and it's something that you're going to have to work on over a course of time with the help of your therapist. Anxiety is your body's alarm system. It's designed to help you to protect your life. Believe it or not, there are people who are born with limited ability to feel anxiety. They tend to die early because they do too many dangerous things. Anxiety is there so that we don't do dangerous things or escape when we're in a very dangerous situation. Anxiety has three basic components, and we're going to talk about them. It's got physical components, emotional components, and behavioral components. Anxiety is not any one of them. It's what happens when all three of them are working together to produce the experience that makes you so very uncomfortable. You have an anxiety disorder when that alarm system is not working properly. I always like to give this example. If you were driving along and you were crossing the railroad tracks and your car stalled and the train was coming, your heart would beat like crazy. You would feel a tremendous surge of adrenaline. You would feel a need to get out of that car no matter what. You wouldn't even think you had an anxiety problem. You would know that a train is coming. So that's not a disorder. But when you're just driving along and everything is going just fine, and all of a sudden you're hit by this sense of tremendous anxiety, you will have an anxiety attack or a panic attack, and that would, if it's repeated, be an anxiety disorder. So, of course, when you're having these experiences in a real dangerous situation, there's nothing wrong with that. That's what's supposed to happen. That's there to protect your life. An anxiety disorder occurs, however, when these experiences of anxiety occur over and over and over again without a good reason and begin to impair your life. That's what we define as an anxiety disorder. Now, it's important to remember that some people are more prone to experience anxiety than others. Some are born with a more temperamental anxiety system, as it were. There might be a genetic history of anxiety in your family. You might have had early experiences that tended to enhance the experience of anxiety. And all of those things may increase the chances that you will develop an anxiety disorder. And then, of course, there are some major traumas that can occur that tend to make all of this crystallize into a true, real problem. So anxiety has many ways of showing itself. Anxiety is frightening. It can feel like a heart attack. And the reason that it can feel like a heart attack is because it causes your heart to increase its rate of beating, and it beats stronger, and you can really feel it. And you can also feel short of breath when you're having that kind of experience. That's part of the physiological aspects of anxiety. There's also a sense of impending doom. And sometimes these feelings are less intense, and sometimes they're more a quality of worry. But always there's some kind of sense of something terrible happening. Because remember, that's what anxiety is there to tell you. Now, some people who are more prone to feeling the physical aspects of anxiety may not be as aware of that sense of impending doom, but it's still there on some way or other. I want you to kind of imagine being chased by a bear. Would you be better off feeling calm, quiet, and peaceful, or scared out of your mind? Which would help you to save your life? In a real dangerous situation, we need to be frightened so we can take action. But an anxiety disorder will make you feel frightened worried, or anxious, when there's not a really good reason to be anxious. Now, there are many types of anxiety disorders. One of the more common ones is called Generalized Anxiety Disorder, and it's a tendency to worry about all sorts of things, often things that other people never worry about. The next kind of anxiety disorder is a panic disorder. These disorders are the ones that I was really referring to earlier. It's as if the bear is chasing you, as if the train is coming. They're sudden, they come on very quickly, they build over a very short period of time, make you feel terrified, and eventually calm down, but you usually feel very tired and exhausted afterwards. The next kind of anxiety disorder is a social anxiety disorder. This is actually the most common kind of anxiety disorder. It has two types: generalized anxiety disorder, generalized social anxiety disorder, and a performance anxiety disorder. And we all kind of know about performance anxiety. You know, it's time for your recital at music class, and you're getting all nervous before your performance. As a matter of fact, that's pretty common. There are very professional, wonderful musicians who get sick to their stomach before every performance, but they perform well. Generalized anxiety disorder is a worry about people thinking negative things about you. And it's really very important that we have that tendency, because when we were first humans walking on this earth, we were parts of very small bands of humans. We wouldn't survive without strong membership in that particular group. So if we were on the outs with the group and we were kind of ostracized, we would be in real danger of losing our life. So social anxiety is an important part of our lives. It's just that when it gets to be so extreme, people with the social anxiety disorders, generalized social anxiety disorders, tend to have problems in normal social relationships. They don't get married as often because they don't get into the social mix well. They don't get promotions as well. So those are all real anxiety disorders as well. Then we have phobic disorders. These are things like being afraid of elevators, afraid of heights, things of that sort. Another one that's of great concern to us is health anxiety disorders. These disorders occur when a person is too worried about their health. They worry about this health problem or that health problem. And they might really have a true health issue, like some kind of heart problem, but their worry and anxiety about it is so excessive that it impairs their life over and above what that medical disorder would do. And finally, there's post-traumatic stress disorder. We won't talk much about that today, but it's a disorder that occurs when there's been a major stress could be life-threatening. When you have that kind of an experience, that often changes almost everything in your life overnight. We have a very special approach for that. We're not going to be talking about that much in the rest of this presentation today. So there are many aspects of anxiety. Today, or this moment, I'd like to talk about cognitive factors. There are many ways we think that can lead us into difficulty. Now, all of the things I'm going to talk about are things that we all do. They become a problem when they become so characteristic of the way we think, or so intense in a particular way, that they block out our ability to be flexible in our thinking and to solve problems realistically. The first is catastrophic thinking. That's the person who sees the most horrible outcome as what's going to happen. And they have trouble moving their head away from that catastrophic thought onto more realistic or likely things. The next is all or nothing thinking. All or nothing thinking is pretty common at times. We tend to expect it to be all this way or all that way. It's like, when you have the thought that a little drop of something contaminates everything. The little bit of something wrong makes you terrible. You didn't get 100% on the quiz. Oh my God, I failed. That's really all or nothing thinking. The next is worst case scenario thinking, and that's really a lot like catastrophic thinking, but it's a little bit different in this sense. We could have 3 or 4 different possible outcomes. The only one we think about is the worst possible outcome. And we don't ever get away to thinking about what's more likely than that worst case scenario. Oh my God, the house could blow up. Yeah, it could, I suppose. But that's probably not the likely thing to happen. Another is emotional reasoning. And this is really important in an anxiety disorder because you're anxious. You're physically aroused. And if you think according to the way that physical experience tells you to think, you're going to be sure a disaster is coming because that's what your body is trying to tell us. So what you want to be able to do is to be able to step away from what the emotions are and to think about the facts in front of you. Another problem that we get into is excluding the positive things in a situation and only focusing on the negative, or emphasizing the negative to the extent that we don't really pay attention to the positive. So those are the cognitive factors. Next, we're going to talk about the physiological factors in anxiety. I want you to understand that your brain is a very complex organ, and it has many different subdivisions or parts. The part that I'm going to talk about for the moment is called the amygdala. It's kind of at the bottom of the brain. There's one on the right side and one on the left side. And its job, for our purposes here today, is to be the alarm center of the brain. It sounds the alarm, literally. It triggers the physiological responses of anxiety. It sensitizes the rest of the brain to be on the lookout for other things. One of the things that happens when this process is triggered is your pupils dilate so you can get more light in and you can see things more clearly. And here's another thing important about the amygdala. It doesn't understand language very well. You can talk to it all you want, and it's like you're speaking some foreign language. It has no clue what you're saying. It only learns from experience, and we'll get back to that later. Now, the physiological processes that occur are increased heart rate, breathing changes, your pupils dilating, as I said, your blood pressure increases, you get lightheaded at times, and you have an internal stress response, which includes cortisol and other chemicals being dumped into your bloodstream. One of the purposes of those chemicals is to keep all of this stuff going long enough for you to escape the danger situation. Those are the physiological factors. These are the things that most people are aware of pretty clearly when they have a panic disorder, not so much with generalized anxiety disorder or social anxiety disorder, but they do occur in those situations as well. Next, we have the behavioral processes involved in anxiety. Some of these are obvious, but some of them are probably not as obvious. The first is hypervigilance. That's a pretty complex kind of thing. It involves being more aware of dangerous things than of other things. Being on the lookout for these kinds of things. One way I think about this, imagine you're in the Army Reserve and you're up at Camp Grayling for summer training, and your job is to guard the perimeter. Well, you know nothing's going on. So you're paying attention, you're not going to fall asleep. But if there's a rustle in the bushes, you're not going to make a lot of it. But let's say you were in a war zone and you were now guarding the periphery. If you were rustling in the bushes, you would not pass it off. You'd be listening very carefully. Your eyes would be focused. And that is something that happens in anxiety. So if you've got a social anxiety, you're very attentive to a person's tone of voice or their gestures and things like that. It's something that happens automatically. You're not aware of it happening. It's very important that you learn about that. The next is escape. If the bear is chasing you and you don't escape, you're dead. So it's important to escape real danger. But when we escape from a situation in which we're not really in danger, but we feel we're in danger, we actually wind up reinforcing our fear and making it stronger. And that's because when we get away from the situation, our anxiety drops. And when our anxiety drops, our brain learns, yes, see, that was dangerous. You're smart to get out of there. Similarly, we avoid things when we anticipate we're going to be anxious. So the person with social anxiety doesn't go to the party. What do they learn? Nothing that's going to help them become less anxious, that's for sure, right? So escape and avoidance cause negative reinforcement. And that's the most powerful reinforcement on earth. Negative reinforcement is not getting punished. Negative reinforcement is having something painful, difficult, or very uncomfortable removed. That is very reinforcing. Escape and avoidance are real problems for folks with anxiety disorders. So, how do we intervene to change this? Well, we're going to talk first about how we deal with the physiological factors. We are going to train you in what's called the relaxation response. Now, this is not relaxing as most of us think of it. It's not chilling out. It's not sitting down and listening to some nice music or something like that. It's a very careful, deliberate effort to change our physiological arousal level by working from the outside in. And we're going to do it together right now. So what I'd like you to do before we go any further is sit down for a second, rate your stress level now from 0 to 10, where 0 is no stress, 10 is the worst stress you can imagine. Just in your head, think of what that number is. Then we're going to engage in the relaxation response, and we're then going to ask you to rate your stress level again. Now, if your stress level is pretty low right now, you're not going to feel a big drop because you can't get much lower if you're already low, okay? So we're going to practice this today, right now, but you're going to have to practice this on your own regularly because we're training the brain. We're helping to build circuits in the brain that counter the physiological arousal of anxiety. And remember, as any music teacher would tell any music student, only perfect practice makes perfect. So you really, really, really have to practice this. Now, I have to make that really clear. If you don't practice it, you won't learn it. And many times I've had folks come back after I've taught them how to do it and say, yeah, I tried it. I was in a really tough situation and I tried it and it didn't work. And I've already told them to practice it before they get into those situations. And what can I say? If I'm trying to learn to play the piano, I'm not going to practice in front of an audience at Carnegie Hall. That's the only thing I can tell you, okay? You got to practice. That's what's going to make it work. So, let's do this right now. So get yourself into as comfortable a position as you can. Close your eyes if you can. And if you're not comfortable closing your eyes, just take a gander down toward the ground. Now I want you to listen to my voice. Take a quick scan through your body. Look for any areas that feel particularly tense and allow them to quiet down and slow down a little bit. If you have any extra tension, just try to shed it if you can. Now turn your attention inward. I'd like you to pay attention to your breathing. I'd like you to notice how you breathe in and out. And for most people, there's a slight increase in tension as you breathe in and a slight decrease in tension as you breathe out. I'd like you to just now spend a few moments being aware of that. I'm going to be quiet and let you do that for about 30 seconds or so. Great. Notice how fast or slow your breathing is. Picture the air coming in and filling your lungs. Feel it going way down into your stomach and into your pelvis. Now, of course, I know it doesn't really do that. That's okay. Just picture that in your own mind. Feel the air going in and going out. And as you do, allow your breath to slow down, to deepen. Allow yourself to feel the air filling your body with fresh, clean air. And imagine that as you breathe out, you're letting go of all that tension. Just let it go. And as you do that, we're going to take another little scan through your body. Notice any tension in your face, in your neck, in your shoulders. Let that tension go. Feel that tension in your arms and hands. Let it go. Your shoulders, your back, your stomach, your buttocks, your thighs, your legs. Perhaps you can even imagine or think about how the chair is supporting your body. You don't need to. The chair is doing it. And all while you're doing that, you continue to breathe quietly and comfortably, deeply and slowly. Enjoy those feelings. This is a time right now when there's nothing going on around you that you've got to worry about. All your cares and concerns are a mile away, maybe two. This is your time, your space, your opportunity to let your body rest totally. You're breathing quietly and peacefully and deeply. As you do this, you're probably going to notice that thoughts kind of enter into your head. You can't stop that. But what you can do is you can just let them on go and refocus your attention on the breathing. Thoughts will enter into your head. That's okay. You bring your focus back to the breathing, to the quiet, and you allow the breathing to take over. Because that's the basic function of life, is breathing. Quietly, peacefully, and deeply. Now, rate your stress level again, 0 to 10. Continue to breathe quietly and peacefully. Continue to allow yourself to feel the chair supporting you. Continue to let yourself focus on these things. If thoughts come into your mind, just let them pass through. Breathe back. Remember to focus again on your breathing. And once again, I'm going to be quiet for about 30 seconds. You've got to practice that over and over again to get any good at it, all right? Next thing we're going to deal with are the cognitive factors involved in anxiety. One of the things I want you to do is to identify your style. Are you a person who tends to catastrophize, worst case scenario, all or nothing thinking. Those are all things that you're going to need to learn about yourself. And our therapist will work with you to help you to do that. I want to explain to you how this works in anxiety. When you get into a situation, thoughts occur to you. Some of them are going to be very much in your awareness, and other ones, frankly, not so much in your awareness. But they're there if we do some probing. These are called automatic thoughts or explanations. And one of the things that you do is you get these things whether you want to or not. We call them automatic because you're not deliberately thinking them. They're happening. So, for example, let's imagine that I'm called into my boss's office. And I have the thought, oh my God, I'm going to get fired. That's an automatic thought. Now, in reality, sometimes a person is called into their boss's office and they're going to be getting that bad news. But most of the time, that's probably not why they're being called into their boss's office. But it's not an unusual kind of thought for a person to have, I guess, when they're being called into their boss's office. And it's going to make you anxious. And you might, at that moment, begin to have all those problems like, oh my God, I'm going to be out of a job. I'm not going to be able to pay my bills. I'm going to be living out on the street. Again, catastrophic thinking, worst case scenario thinking, right? What we have to learn to do with automatic thoughts is question them. Ask ourselves, are they realistic? Well, we have ways of teaching you how to do that to make that job a little bit easier for you. If I know that I tend to be a person with catastrophic thinking, and I've really spent my time identifying the ways I go about thinking in these kinds of situations, I'm preparing myself to be ready to attack those catastrophic thoughts, okay? So the first part of working on the cognitive factors is to help you to become aware of your cognitive style, aware of your automatic thoughts, aware of the beliefs that tend to produce anxiety. And we have tools to help you to do that. Then what we have to do is to develop realistic alternative thoughts. So if I think of my automatic thoughts or my problematic beliefs as kind of toxic thoughts, poisonous toxic thoughts, I need an antidote for the poison, right? And so we have to develop alternative thoughts. But there's two things that have to be present in a workable alternative thought. It has to be realistic. You can't be lying to yourself. That's not going to help you because you're not going to believe it. You're going to know you're bullshitting yourself, as it were, right? Now, what you want to do is you want to have a thought that's realistic, that fits the situation, but also helps you to manage the situation in an effective and productive way. So, the tool that we've developed, actually others have developed, we just use it, is called a thought record. And it has on it a number of columns. And those columns will help you to learn from it. This is an example of a thought record. So notice the columns. What's the situation? My boss called me into the office. What was my automatic thought? I'm going to get fired. What did I feel? I felt my heart beating like crazy. I felt scared. What's the evidence for and against the thought? Now, this is what is difficult because you're all upset, right? You've got these thoughts, right? What you need to be able to do is step back from those thoughts, back from that feeling of anxiety, and begin to think about what's really going on here. Wait a minute. My boss has called me into the office 20 times in the past. I've never been fired. Do I have a particular reason to think I'm going to be fired this time? Etc. So we have to develop a way of thinking through a problem. And again, we have some handouts to give you that might help you with that, things that you can do. And then we want to develop an adaptive thought. Okay, there's obviously something going on, and I'm going to find out what it is. It's not likely that I'm going to get fired, but no matter what happens, I'm probably going to be able to deal with it. It has to be realistic and adaptive, all right? So this is a thought record. And one of the things that therapy will ask you to do often, not always because different people have different needs, is to use a thought record regularly as a way of learning about your thinking, your responses, and developing alternatives. I can't emphasize how important it is for you to use the tools that we do provide you. So when it comes to modifying your problematic thoughts, you need to practice that every day. Now, sometimes it's good to write out your common fears and thoughts and write out adaptive thoughts and read over it every day. It's kind of like practicing your scales if you're a musician. You want to have these things handy and ready to use when you need them. So now we come to dealing with behavioral factors. The first piece of advice that I have to give to you and to anyone suffering from anxiety is this: run toward your problems, not away from them. If you run away from your problems, that's escape or avoidance. That leads to negative reinforcement, and it makes the anxiety worse. It doesn't help change anything. And therapy is not about primarily making you feel better. It's about making you make changes that will help you to feel better. So I want you to run toward your problem, not away from it. But I don't want you to run toward the bear. Only towards things that are not really dangerous, okay? Another way that you can do it is practice acting in a way that's opposite what you feel. You feel scared, act in a way that would be brave or courageous. Walk into that boss's office with your head held high, ready to greet him. We want you to develop a hierarchy of fears, because I don't want you to face the worst fear right away. I want you to face littler fears, ones that you can deal with, okay, and then ones that are a little bit higher up on the hierarchy. So imagine it's kind of like a stack of blocks. If I deal with the one on the bottom and pull it away, assuming, of course, I'm not knocking over the whole pile, but if I can just pull out that last one, all the others drop down, right? And so the one that's second is now no more problematic than the one that was first. And so we sometimes do what's called an exposure hierarchy, in which we work through the level of fears one at a time. So if you're afraid, say, of riding on an elevator, I might take you to an elevator and just have you watch it for a while. And when you're really comfortable watching it, then I might have you walk up next to it. And when you're comfortable walking up next to it, I might have you press the button and watch the door open and close. And on and on and on. Eventually we'd get you to take the elevator up to the 30th floor and back down, but not right away, because that would be overwhelming to you. During exposure, which is what that is, we want you to combine relaxation and exposure so that you're using those breathing techniques we talked about earlier to manage anxiety. We want you to be aware of what's going on in reality. I want you to be able to learn to focus on what's happening, not necessarily what you're feeling. So you're afraid of the elevator. Okay, you get on the elevator, you get anxious, but I want you to be aware of the fact that the elevator is operating normally and it's taking you from one floor to the next. And it's very important that you do those things, because what are we trying to do? We're retraining the brain. And that takes effort. And then after the experience, we want you to talk about, to yourself that is, about what you've learned. Now, if you're like a lot of people who are anxious, if you're not prepared to do this, what you learn is, oh my God, that was scary as all heck. Well, that's true, I guess. I mean, otherwise, why you wouldn't have any anxiety, right? But what did you learn? I learned that the elevator worked. And I want you to be on the lookout for the thoughts that you have that kind of invalidate your experience. Oh, but I just got lucky. and things like that. Because no matter what we're talking about, it's unlikely that the vast majority of time you've been in contact with whatever it is, you've had terrible experiences, all right? Now, mental exposure can work too. So imagine think about something that you tend to be afraid of. And go through the same process mentally. So for example, let's say we were talking about the situation with the boss. I would ask you to close your eyes, picture yourself walking toward your boss's office. Now you know where your boss's office is. You know what color the carpet is. You know what color the walls are. You can picture all of that stuff. You know what your boss looks like. You can picture all of that stuff, and you're relaxing, and you're thinking the positive thoughts. You're getting yourself ready to walk into that situation with a different headset. And it works. As a matter of fact, we know from research that when you picture in your mind a situation vividly, the circuits in your brain are activated that are activated in the real situation. So mental exposure works, and we will use that with you often when we can't do exposure in the real world, or what we call in vivo exposure. So what should you expect when you enter therapy? Well, we'll be giving you some self-help resources. Now, for many people, all they need are self-help resources. They've got enough strength within themselves. Their anxiety is not all that terribly severe. The self-help resources can help you quite well to overcome mild anxiety. But if that's not enough, we then have you involved in therapy. Now, most often that's going to be an individual therapy. Sometimes group therapy can be quite appropriate, but for the most part, we're going to use individual therapy. Therapy is there to help you to change how you think and act. Now, I want to be really, really, really honest with you. It's not venting. It's not telling your story. It's not having a therapist be nice to you. Although hopefully your therapist is not going to be mean and nasty. But the purpose of therapy is to cause you to change how you think and how you act. And that means we're going to have to help you to see how you think and how you act, help you to think about that and challenge that for yourself. The hardest thing about therapy is you're the one who has to do the work. The therapist is your guide. The therapist knows anxiety, knows how people think when they're anxious, gets to know how you think when you're anxious, and helps you to see how you think and how you act. But when it comes to making changes, I'm sorry you have to do it. That's just the way it is. You're the one who lives your life. We don't. So you're the one who has to make the changes. And so you'll have a visit. The therapist will work with you. They'll probably ask you to do things between the visits. And if you don't do those things, don't expect to get better. Real simple, okay? How long will therapy last? Well, it's hard to give a set rule for this, but 12 to 16 visits should cover most people most of the time, okay? And in therapy, we will go over all the things that we talked about today in terms of physiological arousal, cognitive interpretations, and behavioral avoidance and exposure. It's really important that you do the things that we talk about in therapy, the homework. Because if you don't, you're not going to get better. And you might find your therapist saying something to you like, hey, are you ready for this yet? Maybe we need to put it off for now because you're not doing the homework, so maybe you're just not ready to do this. Or maybe we need to talk about why you're not ready. Will you enjoy your therapy sessions? Well, hopefully not like you enjoy going to a good baseball or football game. Hopefully not the way you enjoy going out with your buddies wherever you go to have fun. But you should feel you're getting something out of it. You should feel that your therapist understands you, understands what your problem is, and is making a real bona fide effort to help you. Hopefully that will feel good. Hopefully you will experience an increased sense of ability to face your problems and hope that you'll get better, because I know how discouraging it can be to have a problem that you've struggled with for a very, very long time. So, therapy is there to help you to change. It's there to help you to learn skills that will enable you to face anxiety. Will anxiety ever go away completely? No, of course not. Will you need booster sessions maybe once in a blue moon? Sure, maybe you're going to need booster sessions once in a while. But if you internalize this stuff, if you really learned this stuff, you now have tools that will get you through a whole bunch of situations that you didn't think you'd be able to deal with before. So, we want to wish you the best, and we want you to work hard with your therapist, and thank you very much for paying attention to this today.